Hello and welcome to another session of Dr. Barbara Miller's NCLEX and his Nancy review. Today we're going to be talking about schizophrenia, that is a psychological disorder that can impact negatively on the person and also family members. So what is schizophrenia? It's a complex brain disorder that affects thinking, language, emotions, social behavior, and the ability to perceive reality correctly. They do have phases of schizophrenia where it could go from the acute phase to maintenance phase. So let's start with the acute phase. Okay, it's an onset or an exacerbation of symptoms with loss of functional abilities. Stabilization, symptoms diminished and client progress towards previous levels of functioning. Then you have your maintenance. The client is at or near baseline functioning. How do you assess schizophrenia? And the boards will ask you. You do have positive symptoms versus negative symptoms. So what are some positive symptoms that you should look for? Okay, so positive symptoms are the presence of something that is not normally present, such as alteration. Alteration in thought include delusions that are false, fixed beliefs that cannot be corrected with reasoning. The patient will also have alteration in thoughts, okay, alteration in speech. They will have word salad. So positive symptoms, hallucinations, delusional thoughts, okay, different types of hallucination. They will have visual hallucination, seeing things, auditory hallucination, hearing things, tactile, feeling things that crawls over the body. They will also have a catatonic type of hallucination where they become like a mute or like a stooge. They will sit in one position all day where they urinate, defecate, and that could cause physiological problems. So those would be positive symptoms. So what are some negative symptoms? Okay, like a flat affect, no expression on their face, apathy, they have no motivation, and anhedonia, meaning that they feel no pleasure in life. So please do know the difference between positive symptoms and also negative symptoms. So the nursing intervention, you want to provide structured, safe environment like a milieu therapy for the client in order to decrease anxiety and to distract the client from constant thinking about hallucinations. You want to promote therapeutic communications and to lower anxiety levels, decrease his defense patterns, and encourage participation in their milieu therapy. You want to establish a trusting relationship with the client, use appropriate communication to address hallucinations and delusions. You want to ask the client directly about their hallucinations. The nurse should not argue or agree with the client's view of the situation. Do not argue with the client's delusions, but focus the client's feelings and possibly offer reasonable explanation. You also want to assess the client for paranoid delusions, which can increase the risk for violence against others or violence against others. Also, attempt to focus conversations on reality-based subjects. So you also need to know the different types of medication that they use to treat schizophrenia. First generation antipsychotic treats positive signs such as thiodazine or torazine, haloperidol, loxapine. Second generation antipsychotic treats positive and negative symptoms such as clozapine, olanzapine, quetiapine, and risperidone. The therapy, cognitive behavioral therapy, can assist in controlling these symptoms. Thank you for watching this short video on schizophrenia, which can impact negatively on the overall family members and also the patient. Thanks for watching this short video. Please like, share, subscribe to the channel to help it grow. See you in another video.